Hi everyone, my name is Leyla N Yildirim and on today's Zoom lecture we'll be going through major depressive disorder. Major depressive disorder, which is also known as clinical depression or simply depression, is a psychiatric disease that is categorized by distinctly depressed or irritable mood, loss of interest, decreased or increased weight or appetite, decreased or increased sleep, appearing slowed or agitated, fatigue, feeling worthless, poor concentration or indecisiveness, and thoughts of suicide attempts. These symptoms are prominent most days and can last for a minimum of 2 weeks. Based on the 2017 survey conducted by the Australian government of 8.7 million people within the age range of 16 to 85, 6.2% had clinical depression, and of the 591,000 people aged 4 to 17, 2.8% had clinical depression. In Figure 1, females have a higher prevalence of depressive disorder in comparison to males. We can also see that the African region has the highest prevalence of depression in both females and males in comparison to other regions of the world. Now that we've covered what major depressive disorder actually is, we'll be going through the neuroscience behind it. Although the neuropathic aspect of depression is still not completely understood, here is what we know so far. Neuroimaging methods such as MRI have been the main source in studies to identify any brain changes that is associated with major depressive disorder, and as a result have come to the conclusion that several brain regions are impaired significantly in these patients. Through the use of MRI scans, it has been identified that numerous gray matter changes are present in the frontal lobe, parietal lobe, thalamus, caudate, pallidum, putamen, and temporal lobes. Diffusion tensor imaging shows the microstructure of white matter and has identified alterations to white matter as well. Additionally, patients with depression have abnormal brain activity, specifically in the prefrontal cortex, occipital lobe, temporal gray, caudate, and putamen. Before we continue, we first need to also establish that the different brain regions are interconnected and form the brain's complex networks. Figure 2 depicts a structural network of hubs, which is a region that is connected and central and is essential for global information integration. Some studies have established that an impairment of hub nodes or its connections might actually be the main cause of mental illnesses such as major depressive disorder. Patients with major depression have the cortical-subcortical circuit as their most common functional connection hub, and within this connection, the frontal lobe, parietal lobe, thalamus, putamen, and hippocampus are present, implicating that any abnormality to these areas can cause major depression. An example to this is in Figure 3, which is a suicide circuit present in patients with major depression who committed suicide. There are abnormal connections on mainly the left anterior side of the brain, which includes the left middle frontal cortex, the left thalamus, and left anterior limb of the internal capsule. Some of the symptoms of major depression are prominently associated with the 3 main monoamine neurotransmitters in the brain. These include dopamine, norepinephrine, and serotonin. This indicates that specific symptoms of clinical depression are due to specific neurochemical mechanisms, and therefore, specific antidepressant drugs can target these neurotransmitters. In order to treat major depressive disorder, a combination of psychotherapy and medication is the most effective. At the beginning, selective serotonin reuptake inhibitors are prescribed. At times, a variation of 2 different antidepressants is used, either with or without a mood stabilizer such as lithium or valproic acid. Antipsychotic medications might also be prescribed if psychotic symptoms are present. Additionally, psychotherapy techniques have been proven to be an effective treatment, an example being cognitive behavioral therapy, which is designed to assist a person with depression to recognize negative thinking and teaches them methods to control those symptoms. Although controversial, electroconvulsive therapy can be a life-saving and effective treatment for those with severe forms of clinical depression. This treatment involves an electrical impulse being applied to the patient's temporal lobes, causing a seizure. During the procedure, the patient is under anesthesia and monitored regularly and is prior given medication to prevent convulsions, thus preventing injury. Although we currently have pretty effective treatments for major depressive disorder, we're still in the hunt to find better and improved technology to treat this condition. Both ecological momentary assessment and ecological momentary intervention are alternative treatments to review self-reports and face-to-face treatments for major depressive disorder through examining patients in a more naturalistic environment and provide psychological support in daily life. As a result of the demand in smartphone applications, as well as the availability of low-cost portable and wearable biosensors, there has been an increase in the potential of ecological momentary assessment and ecological momentary intervention being an alternative treatment in the future. Due to this, there has been an influx of research exploring new and other technologies as potential treatments for major depressive disorder. To wrap up, the brain is a very complex organ, and there is still no clear understanding of how major depression disorder and neuroscience is connected. In order to provide extremely useful treatments and preventative measures, further study is essential to understand the complexity of the human brain.